In this video, we discuss the use of NSAIDs during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Non-steroidal anti-inflammatories have been used for pain relief since at least the beginning of written history. Willow bark, which contains acetyl salicylic acid, also known as aspirin, was prepared in teas to relieve pain by many, including by Hippocrates, the father of Western medicine. Non-steroidal anti-inflammatories that have been found to show promise against cancer include low-dose aspirin, ibuprofen, Celebrex, etodolac, diclofenac. All of these require a prescription in America except for low-dose aspirin and ibuprofen. In 35 countries, including much of Europe, diclofenac is available over the counter. The findings on the use of low-dose aspirin and ibuprofen in cancer are mixed, but from our reading of the literature, we would say that studies support their use at least in a ratio of about 3:1. And when a negative or neutral association is found between aspirin and/or ibuprofen with cancer, the association is generally quite small, quite a bit smaller than the positive associations found. This trend towards improvement seems present in every cancer studied. It seems like ibuprofen may have stronger anti-cancer effects than aspirin when both are used at normal doses. However, the ability to get similar results from a low-dose aspirin compared to a full dose may make it appealing to some people. Ibuprofen, on the whole, has a better liver safety profile than aspirin. The NSAID, with probably the most robust research regarding its efficacy against cancer, is diclofenac, even though Celebrex and etodolac have very strong research as well. In fact, etodolac has already been mentioned multiple times in this section in conjunction with propranolol. Diclofenac was approved for medical use by the FDA in 1988 and currently has over 10 million active prescriptions in the US. Diclofenac acts against cancer in many ways that are different from most of the drugs profiled in our videos, which makes it, and NSAIDs generally speaking, an important addition to most cancer-fighting regimens. Diclofenac affects glucose regulation, PHH regulation, inflammation, especially through the COX enzymes, which are powerful promoters of cancer growth, and platelet aggregation, an important driver of angiogenesis and metastasis. Diclofenac may also make cancer more sensitive to chemotherapy and radiation. Diclofenac has shown efficacy in numerous cell lines and animal models including melanoma, leukemia, neuroblastoma, brain cancer, colorectal cancer, ovarian, pancreatic, oral, and prostate cancer cells. Because NSAIDs are so commonly prescribed, virtually all of the studies performed on them are correlational studies rather than controlled clinical trials where a drug is deliberately given beforehand, ideally with a control group, to test its effects. One retrospective analysis of breast cancer patients treated with diclofenac before surgery showed improved disease-free progression and overall survival compared to people who did not receive it. Another study showed the same positive results among lung cancer patients who had been treated with diclofenac before surgery. There are also case reports of 7 patients with desmoid tumors, a rare, aggressive but non-metastasizing primary tumor, who were treated with diclofenac and tamoxifen, an anti-estrogen drug. All 7 patients showed either stable disease with no negative side effects or a pronounced reduction in tumor size. Topical treatment with diclofenac also showed efficacy against actinic keratosis, a precancerous skin lesion, in a placebo-controlled trial. The diclofenac-treated lesions showed increased CD8 immune killer cells, infiltration, and decreased lactate levels. Increased lactate levels are associated with poorer outcomes in cancer. Only one type of NSAID should be taken at a time. Taking multiple types of NSAIDs simultaneously can increase the chances of gastrointestinal issues and bleeding. NSAIDs may also interfere with blood thinners. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.